I am here today because 217 lawmakers in Washington voted to take health care coverage away from 24 million Americans and raise the costs on all of us. I doubt those representatives are visiting hospitals today or talking to fellow citizens about the consequences of their actions. But my staff has given me a lot of numbers, and the numbers are compelling. But what I wanted to do is talk about the real lives of people that are behind those numbers.
Both of my children were diagnosed with celiac disease last April. And right before my son started kindergarten, he was diagnosed with type 1 diabetes. Our access to health care was what enabled us to find that diagnosis, that type 1 diabetes diagnosis early, preventing him from what could have been a very miserable experience going into DKA, which could lead to weeks in the hospital and very dangerous situations. And I'm here to advocate for that access to health care for everybody, especially in this situation, because I can't imagine if I had hesitated how bad that could have been.
And it took 8 months before we could diagnose what she has, and that's called systemic onset juvenile rheumatoid arthritis. It's the most severe, it's the least common, and it not only affects her joints, it affects Victoria's organs. So in addition to having joint pain, getting fevers, and having rashes, Victoria also has interstitial lung disease. For us, what does this all mean? You know, this is already not fair to us. This is not fair that a 13-year-old, at the time 8-year-old, had to come to hospitals every month. And to think that, you know, one day she may not have access, or that access is going to cost us even more money, is just beyond me.
We have parents of disabled children like Sam and Bob. Sam's coverage for his son comes from his employer, but the Affordable Care Act has shielded his son from lifetime caps, and one time sent many families into bankruptcy.
He has a motor neuron disorder called hereditary spastic paraplegia, which mostly affects the lower extremities. It's a progressive disorder, so he requires physical therapy regularly in order to maintain the functionality that he has. So if you take away the essential covered benefits, the insurance company would never pay for this. Another thing that we're concerned about is if you take away the requirement that people with pre-existing conditions have to be covered, then how will he get insurance when he's of age? You know, if we were to change insurance companies, would they cover him? You know, it's unthinkable that he wouldn't be able to be covered. And without the regular treatments, without the physical therapy that he gets, you know, he could conceivably, you know, be bedridden.
It is impossible to be prepared for a catastrophic event at delivery of a baby like my daughter, Annika. We had home nursing care and every therapy you can think of, physical therapy, speech therapy, occupational therapy, and early intervention. Medicaid continues to be a super important part of her life. Along with continued medical care, Medicaid helps pay for much needed respite and will pay for Annika's future long-term supports and services when Odette and I are no longer able to care for her, and is literally the lifeline that provides critically needed funding for supports and services for people with intellectual disabilities. Without a well-funded Medicaid entitlement program, Odette and I and millions of families would have no hope.
I ask what types of options are left for families when the program that serves 2 to 5 disabled Americans is gutted it's $800 billion. It's it's an enormous consequence to disabled children as well, because something that they did in this law people don't know about is that school districts have received Medicaid funding for taking care of disabled children. And that is an enormous amount of money. Under the provisions of the legislation they pass, school districts will no longer be eligible for any of that Medicaid funding.
Medicaid supports. I think there's a misconception that Medicaid is only about health care. But Medicaid supports day programs. Medicaid supports housing. Medicaid supports individuals with developmental disabilities throughout the lifespan. And as my husband and I age, we are fearful already about how he is going to fare in the world when we're not here to support him. And we've, at least up until now, had some comfort in knowing that there is some system in place to at least fund the services that he needs. With block granting, with that funding staying stagnant, each year the pot of money shrinks. And coupling that with the increasing number of individuals needing to access that pot of money, in very short order, I think we're going to have, I don't even want to imagine what the world will be like for individuals like my son.
I don't know what moral compass a member of Congress can cast a vote like that. I don't believe the Affordable Care Act is perfect. And I have, for the last 7 years, been one of the advocates to improve it. But every time we've tried to improve it, all we've had is an attempt to slay it. It's a little difficult to improve something when you're, instead of opening up the page and to heal them, you want to kill them. And that's what we've had here. We have people like Martha, who is a provider and a patient. She's been a psychotherapist who has served low-income patients for many years. Fortunately, earlier this year, she was diagnosed with a rare form of cancer.
The pills that I need to take every day cost $112 a pill. I take 4 pills a day. That's $165,000 a year. I have 2 children who are middle schoolers. I could never afford $165,000 a year just for my medication. Without the ACA, I wouldn't have access to any insurance. We would never be able to afford premiums. If I was put in a high-risk pool, I would burn through that very, very quickly. I see the cost and I feel the cost of what financial toxicity costs patients. And the anxiety that the uncertainty around our healthcare situation has injected into our household, and how much more terrifying it has made an already very, very terrifying season. Medicine can save me, and our healthcare policy may seal my fate. So I'm really counting on the Senate and our New Jersey delegation to really help save my children's future. I don't want to see them motherless, obviously, and I don't want to utilize all of their financial security to stay alive.
This legislation also includes what I call an age tax, and unfortunately I'm in that age, that will directly impact people with us like Sherry, who is 63 years old. The bill will hike premiums for older Americans by anywhere between $8,000, $10,000, or $12,000 per year.
Insurance is an absolute necessity for me, and I'm going to get doubly hit with what the Republicans are planning to do. On top of that, my son, who could not be here today, is 23 years old, and when he was 11 years old, he was likewise diagnosed with juvenile rheumatoid arthritis. He didn't do well initially until we found the right medication, and he is now on a biologic medication that is enormously expensive. It's thousands of dollars a month. It is something that is covered by insurance and is not affordable if we did not have adequate insurance to cover it.
Incredibly powerful stories, real life stories that reminds us that there but for the grace of God goes any one of us. Secondly, I appreciate that you're willing to share very personal health information, which we try to keep private. And so your willingness to do that is very courageous and not easy to come in front of a group of cameras and tell people what you have. But by the way, you all look great. So I'm glad to see the medical industry is doing fantastically well by you. But at the end of the day, it is a powerful story so that we understand when we talk about these numbers about $800 billion in Medicaid. It's not $800 billion, it's lives. Millions of lives across the country. When we talk about a pre-existing condition where we have under the law an absolute guarantee that could not prohibit you from getting the appropriate insurance, we now lose that guarantee under the Republican provision. When we talk about young people, and I appreciate all of you are willing to share your children's stories, which is our future, then ultimately we understand that when we have these huge cuts to school districts throughout the country and to the mandate under Medicaid to provide for those who may have some form of disability, we basically, for a Congress that constantly talks about family values, we shortchange the God-given capabilities of each and every one of those individuals. So, thanks so much. And with that, let me turn to my colleagues. I'll tell you this, I am going to do everything and I mean everything to make sure this isn't the result. With that, let me go.